As a nurse, we're always taught that we are the critical thinkers. We get to be the ones who question providers if we don't feel like it's safe, right? So we're that last stop shop for patients. But what patients don't understand is they're actually the last stop shop, right? So patients still, even if they're about to get the medication to put them under sedation, to go into a procedure, just are like, whoa, 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 this isn't for me. You have the right to say no, even in that moment. You have the right to ask for a different provider if you feel that you're not being heard or seen or respected, even if you're deep into work with that provider and it's not working out. My name is Ashley Schimdt. My pronouns are she, her, and I'm the lead community health nurse for Tulalip Tribes. Self-advocacy in healthcare is one's ability to speak for themselves and be an active participant in medical decisions that are being made about them. Ways to advocate for yourself while receiving medical care is to ask questions when you need clarification, ask for providers to slow down if they're going too fast. You can bring support people with you to your appointments to have them take notes or for them to ask questions that you may not be remembering to ask. Asking questions in your medical appointments is extremely important, especially to both ensure, of course, that the patient has a well-rounded understanding of next steps, plan of care, goals of care, but also so everyone can be on the same page, right? Often the provider might be making these decisions, the patient's agreeing to those decisions, but there's no actual understanding of what that will look like long term. And it can leave the patient feeling very helpless and also uninvolved in their care. Parts of their care I wish patients knew they could advocate for right off the bat are things that may be seen as super simple, or even things that may seem like that is just the way they've done since the beginning of time and there's no way that that's going to be done differently, and definitely not for me, right? Of course, a medical provider will encourage you to accept what they feel is the best course of care for you. But if it goes against your spirituality, if it goes against your cultural beliefs, if it goes against your personal values, you have the right in that moment to stop and pause and either say no or ask if there's a different way that it can be done. It is important to take accountability for your own part in your healthcare, right? So a really great way to look at that is your being involved in your care as a partnership. What you're able to bring forth in terms of how you're managing your health, how compliant you're going to be with whatever plan or medications or course of action that is decided, your part is as equally important as the provider's part. So it is truly a partnership. And then that way you're even more empowered to be a self-advocate because you're heavily involved in what's going on. And it can be really uncomfortable, but trust me, it's more uncomfortable for the provider than it is for the patient. And the provider is the one who's responsible for making accurate decisions with as much information as possible. And your responsibility as a patient is to give them the most accurate information of yourself. I wish that patients knew that their consent is everything, right? So they do have the ability to say no. They do have the ability to say yes. They have the ability to ask for another provider if they feel that they're not being treated correctly. You're allowed to ask questions. You're allowed to ask for a second opinion. You're allowed to take a moment. Let me get back to you. Let me go home and process what you just told me before I say yes to the next step. You have the ability to call back and say, I actually decided not to move forward with this. I do find there's oftentimes people don't feel that they can advocate for themselves. And I think that comes from some fear-based, approach in medicine. Also just having a lot of biases that you feel is placed on you, maybe based on medical history that you might have. But really, it's important to know that you have the right to switch providers if you feel that they're placing assumptions on you. You don't ever have to validate your medical concerns or medical needs to a provider. Community health does provide a lot of services that promote self-advocacy. We often do that in the form of attending appointments with our clients to model what self-advocacy looks like. We come with questions to ask the providers. We tell the providers what our client is comfortable or not comfortable with to model that so that they know they can, in fact, do that for themselves. We visit clients in the hospital if they feel that they're not receiving the care or the treatment or the tests or what have you in the hospital. We'll go and advocate with their medical teams to make sure that they're being heard. We walk alongside them as they navigate really complex medical systems, and that is a form of self-advocacy, is really being empowered to do that yourself. It's really difficult, and so we model, again, what that looks like, the navigation side, so that they can do that for themselves moving forward. And so a lot of individuals are at the mercy of what their provider is telling them, but self-advocacy is that extra added layer of asking for understanding so that you're an active participant in your care.